This is Marsha. Marsha is a 5-year-old sulfur-crested cockatoo. We're going to be catching her up today for a sedated blood draw. We are using a towel to catch her up. This is the safest way to restrain a parrot. It's safe because they cannot bite us. It's also safe for them so that they do not flap their wings and potentially injure themselves. Our first step is we're going to give Marsha some butorphanol, an opioid analgesic intramuscularly. We are going to be using the pectoral muscle. It is the largest muscle in a bird, which makes it a really great spot to give IM injections. This next step is we are going to give midazolam intranasally. This does have a very quick method of action, so she's going to start feeling the effects pretty quickly when given this medication. It's just going to help take the edge off, reduce that anxiety. Going to give a couple of drops into one nary, let her breathe it in, switch sides and give her a little bit more. This is Marsha immediately following. She's still a happy cockatoo. She's knocking to get out, showing her personality. This is Marsha about 5 minutes after she received her sedative medications. She is slowing down a little bit. She does have a slowed blink reflex. You might notice she's trembling a little bit. This is all completely normal and expected. Just shows that she's starting to feel her medication. This is Marsha about 10 minutes after her sedative protocol. You can see that she's really slowing down that blinking. She's lowering her head a little bit. She's just feeling the effects and feeling really nice and relaxed. She's not vocalizing. She's not jumping around. She's pretty calm, which makes her a perfect candidate for the next step, which is her blood draw. We are restraining her for a right jugular blood draw. Parrots have a section of aterale or feather loss over the right side of their neck. This is a perfect window for that right jugular vein, which is also 2/3 larger than the left one, which again makes it the best spot for phlebotomy. I am using a 3 milliliter syringe with a 25 gauge needle to slowly pull some blood. To safely draw blood in parrots, you always want to pull no more than 1% of their body weight. We're gonna hold that off. And then we're gonna go ahead and put the blood into some heparinized blood tubes just to make sure that we do not hemolyze or lyse our red blood cells.